We are going to go over the skill of sterile gloving. There's a couple things that you need to get prepared before you put on your sterile gloves. One is you need to put your hair back. Anything that's going to dangle over your sterile field you need to remove. So I'm going to remove my name badge. I'm also going to remove my jacket because the sleeves can get in the way. And then another thing you want to remove is any jewelry. So if you have any rings or bracelets, you want to take those off as well. So I'm going to take that off and put that in my pocket. I'm going to perform hand hygiene. You want to make sure that you're verifying your patient's allergies, because we need to know, are they allergic to latex or not? There are two different sets of gloves, ones that are made with latex and ones that are made without latex. So we need to choose the appropriate, not only for the patient and their allergies, but if I also have an allergy as well to that. So I'm going to go ahead and go with my latex gloves because me and the patient do not have allergies to that. I'm going to make sure my surface is at waist level and make sure it's clean. So I'm going to wipe it down with some clean gloves and a wipe. Then I'm going to inspect my package, make sure that it is intact, it hasn't been opened, and make sure it's the correct size for me. And then we're going to go ahead and open it. So make sure this is clean and dry before we place our gloves on. Going to go ahead and open my package. Open it like this, and then you're going to open it like a book. And it even tells you here, it tells you the left hand and the right hand and how to pull the little flaps apart. So just follow the directions with the picture. I'm going to go ahead and open this flap away from me. Make sure it's folded down. And then I'm going to open this flap towards me and make sure it's folded down and doesn't try to come back up. Okay, now I'm going to open. Carefully make sure the gloves do not stick because you want them to stay within that 1-inch border. So I have this 1-inch border that I can touch with my hands. But once I become sterile, I can no longer touch them. So you want to glove your dominant hand first. So I'm going to go ahead, I'm right-handed, I'm going to glove this hand first. Go ahead and put my hand in. And I'm only touching the folded cuff. So the sterile part of the glove I am not touching with my non-sterile hand. Okay, and then I'm going to just leave it like this. I will adjust it once I have my other glove on. Then I want to do what I call tenting. Hold with my sterile fingers, touch these sterile fingers of this glove. I'm going to go ahead and put my 2 fingers in here under the sterile part, put my hands in here, and pull this down. Okay, now I can adjust this side by doing this and pulling down. Okay, so now that I have sterile gloves on, I have to make sure my hands are above my waist at all times. If I want to remove this, I would need to pinch from the middle, the sterile part, and I could dispose of it that way. But if I want to use this as my sterile field, then I could have someone add sterile items to this. But once I have my gloves on, I cannot open anything that is not sterile. And that is how you put on sterile gloves.